Good afternoon. Hey, my name is Liz Bowen, and I am the owner of Red Bow Realty here in Colorado Springs, Colorado, and the sponsor of the Briargate website, parkbench.com/Briargate. And with me today, I have the amazing Erica and Nick, and they own a mobile chiropractic company called Axon Health. Did I get that right?
Axon,
my apologies.
Close. So close.
All right. So I wanted to invite these wonderful folks to introduce you to their business model and the great things that they're doing to improve the health of folks in our community. So take it away. Why don't you guys introduce yourselves again?
All right. So I'm Erica, or as patients call me, Dr. Abraham. I am originally from Canada, met him in chiropractic school. We got married in our last year, and we decided to make Colorado Springs our home. So, yeah.
Yeah, and I'm Nick, or some people just call me Dr. Pannella. I'm from New Jersey, born and raised, went to undergrad and then chiropractic school in Florida. We knew we didn't want to stay in the humidity anymore, so we came to Colorado Springs because we like hiking too. Yeah. So we love it here.
Wonderful. When did you get here?
January 4th of 2020. So
wow.
So recent, yes.
Yeah.
You just in time for a pandemic. That's amazing.
Yeah, perfect timing. Great way to meet people, you know?
Yeah, but it actually worked out well because we were mobile. So a lot of people, if there's any type of business structure that probably worked better than others opening up in a pandemic, it was mobile. So
were you guys doing this business model in Canada or in New Jersey before coming here?
Nope.
No, so we moved here. We originally had some jobs at another clinic. We were just kind of finding that it was not for us to work for somebody else. You know, it was not the environment we wanted to be in. And so we ended up quitting, and it's the middle of the pandemic. So we're kind of like, well, you know, if we don't want to get shut down and have this overhead when we, are just starting that we can't pay. And we had known a few other chiropractors that were mobile in Florida. I would love to say that it was our idea. It's not. That we knew that they were doing mobile. We were like, well, that might actually be really good for a pandemic, because then we can also cater to the people who don't want to be sitting in a waiting room around other people. And then everybody's working from home as well. Some people don't have desks. They're sitting in compromised positions, and they're having pain now because they don't have a proper workstation. So we can go to their place. We can go to their office if they were working in an office.
Yeah, we do corporate stuff as well. So we have a couple corporate offices that we go to. But the main thing that both of us, like I said, opening up mobile we didn't know if it was going to be what we wanted to do long term in the beginning, but we do not see ourselves getting a brick and mortar unless it's a corporate place for future plans, a hub for our practice. We don't, and maybe build a gym out of there so I can do exercise physiology classes, but I don't know if we're ever going to practice out of an office.
Gotcha. So this is working out really well for you guys.
Yes, we love it. We love it.
Wonderful. So, how long have you been doing the mobile part of your business?
Since September 28th of last year.
So 7.5 months.
Yeah,
not even months. And the feedback has been?
Great.
Very good.
Yeah.
It's a little bit different than I would say. I don't like using the word traditional, but I spend 30 minutes plus with every patient. So patients don't come in for 5 seconds with me. I do a lot of exercise physiology and stability. I look at a lot of core stabilization, hip mobility. I put them through exercises, and I refer them places if I believe they need something for maybe like a longer soft tissue mobilization to a massage therapist and something like that. Not that we don't do trigger point or Grassner or stuff like that, but we don't see our patients for a minute. We spend a decent amount of time with our patients.
I bet they love that.
They definitely do. They definitely do.
So tell me a little bit about your service area. How far do you go, or to what parts of the springs, et cetera, do you travel?
So we cover the whole area of the springs, including Briargate. We also go up to Monument, down to Fountain, and then out to Falcon, Peyton, and then Manitou Springs as well.
Fantastic.
Yeah, so we have a huge market variety of where we can go. It's really a wide variety of places that we'll go, which we love.
Mm-hmm.
I'm sure your clients do too, right?
Yes.
Especially if it's an area that's either newer with the new builds, because there's no chiropractors in that area yet, or it's just underserved with chiropractic care in general. They have to drive a really long distance to see a chiropractor. They do like the fact that we can come to them, and they save the time of having to drive there and wait in the waiting room. So
completely. Yes. I mean, I'm still just trying to wrap my head around it, because I think it's such a wonderful service to offer to folks. Not only people who don't feel comfortable leaving their houses, even though things have changed so much with the COVID restrictions, there's still a lot of people who are wary of being in office environments, like you were mentioning, Dr. Abram, but being around other people like that. And so the fact that you guys are willing to drive in your car and to meet people wherever they are and provide them with this wonderful healthcare, kudos to you. I just think it's a great business model, and it shows such customer service. Prior to this, tell me a little bit about your journey in terms of being entrepreneurs. So were you always in this field? What kind of skill sets did you bring to this as a business? Tell me a little bit about that.
I did not ever expect to own my own business. I think my dad kind of called it when I was younger. I remember my mom coming to me and she was like, your dad's expecting you to like be your own boss someday because you don't like to take direction. So I'm like, oh, okay. But we did come out here with jobs, working for somebody else. But now that I reflect on it where I am now, I never really liked being an employee ever with any one of my jobs. There just wasn't the flexibility. I wasn't able to call my own shots. I wasn't able to come up with my own schedule. So there's a lot of freedom with owning your own business that really attracted me to that. So that's kind of how we got into this, the freedom.
Well, what's been the biggest challenge you guys think in owning your own business?
A second. You want to know what the biggest challenge to our business is?
What?
What do you think it is? Flat tires.
Oh.
Does that happen often?
No, either.
We literally, and that's something. So I myself had, was it 8?
No, 7.
7 flat tires in like 6 months.
What?
And
Yes.
I had 2.
Because you're driving in Briargate, or like I saw an emergency patient in a house. He was a builder that they were. Yeah. So I'm in a neighborhood and all these homes are under construction. The next day I was at the patient's house. I walk out and I called Erica and I said, my tire's flat. Is you just going in neighborhoods, unfortunately, with the developing
potholes, or there's nails on the ground.
Yeah.
So that's probably the one thing that I would say.
That's the one thing about our business, that apparently we need to also own a tire center.
Yeah, we joke about that all the time. I don't think there's anything really else that people
would be surprised to know about.
I mean, the other thing too is, they expect us to go to their homes because that's, what a lot of people do. But when we say, if it's easier for me to meet you at your office or wherever, then I can come and meet you there. I had a realtor actually call me saying, hey, I'm about to do a showing. Nobody's in the house. Can you come adjust me real quick? My back's killing me. It's a very convenient thing because you don't necessarily have to be at home. If you've got some private space, then, we can, as long as, if a business owner if you're not owning the business, as long as they're okay with us coming in, that's probably one of the more surprising things.
I would say the time too. That's one thing I can't say for Erica, because I don't think she spends as much time as I do with my patients, because I'm a talker.
20 to 30 minutes.
Yeah. Sometimes I go an hour. But again, like I said, I don't always adjust. And one of the biggest misconceptions in the chiropractic field specifically is people will say, well, if you don't adjust, what do you do? Because people forget we go to school for almost 4 years, 5,000 hours. It's a lot. We learn a lot of rehab stuff. We get numerous amounts of nutrition classes. Our nutrition teacher was a publisher of multiple peer-reviewed studies. So we get other aspects of care. And in this state, we have a much wider scope of practice than say, I'm a big believer in having the patient take charge of their own health. I think that leads to more optimal results in the literature and just my anecdotal experience as a provider.
We like to try to differentiate between chiropractic care and the chiropractic adjustment. Chiropractic care can encompass a lot of things: nutrition, exercise, stretches, adjusting being one of them. The chiropractic adjustment is one tool within that tool bag of what we can do for patients. And again, it's just one tool. It doesn't necessarily mean that it's warranted, as he said.
Radiographs. My philosophy is a little different, so I don't do that. And we have had people the family contact us looking for someone that wasn't going to do that. Huh? So we have gotten those people, hey, look, I don't want to, subject my 9-year-old kid to radiographs for whatever reasons. I said, Erica was like, no problem. We don't do x-rays like that unless it's clinically warranted. So, but
very interesting.
Yeah, we have a lot of different qualities about us that, are just different in that regard.
So tell me about your near and far goals. So what are your goals for 2021, and where do you want Axon Health to go?
How about I do near and then you do far? Because you did the far ones. Majority came from Erica. So I would say near for us is to continue doing what we're doing. We're really good with. She sets up the meetings. You're the meetings, and I track the finances every day, taxes, all that. So I have monetary value goals and then statistic goals for, say, patient. Because you got to remember, as being mobile people, there is only so many people you could see in a day because we're driving costs and stuff like that. Right. So I would say in the 2021 goal this year, for the rest of the year, in a funny way, would be to not shut down. But we have no intentions of doing that. We are fortunately very lucky to be profitable since the first month in business. Wow. For someone in our profession to say that is unbelievable because we have no overhead really. We don't have a brick and mortar.
So except all those tires, right, Nick?
Yeah, no, I'm not kidding. We spent like $2,000 on tires, which is the funniest thing on ever. But I would say that, continue doing what we're doing, adapt when needed. We all understand that. You get into these grooves and these routines, and when something needs to be changed, it can be mentally tough to make that new direction path. I think anyone in career, no matter if you're a business owner or not, has experienced that. And then you could tell long-term because it's, you're
just
right.
To add real quick to what he was saying about short-term, we did sit down at the end of 2020 and say, okay, ideally by the end of 2021, we want to be having an average of this many patient visits a week. It's May and we've almost doubled that already.
Congrats.
So we're probably going to have to actually sit down and redo those goals, but we do have another goal for the corporate side. We want to have 5 corporate accounts. I think we're at 3 right now. So by the end of 2021, we're hoping to add 2 more corporate accounts to work with. But long-term, as he kind of touched on earlier, we call it Axon Health because we don't want it to just be chiropractic. We want to be able to have a mobile massage therapist or a mobile PT, so we can offer all these different types of services and be known as the mobile healthcare providers, not just the mobile chiropractors. Long-term, that's what we would like. We are in the process of looking for a Ford Transit so that we, like one of the tall ones that you can stand in, and turning the back of it quite literally into like a little mobile clinic so that if we do have a corporate account, we don't need to be finding a room where there's privacy. They don't have to, if everybody's got their own room, we're not taking over somebody's office. We can actually just have them come out. We can treat them in there and then they can go back inside.
But yeah, like I said, we love what we do. I tell Erica, now that we do what we do, I will never work for anyone in my life again, ever. Like it's just not for me. Good. So I personally am willing to work more to be able to build something that's ours. So
how do people get in touch with you guys?
There's a few ways. Our website is www.myaxonhealth.com. All of our contact information is on there. They can also follow us on Instagram at Axon Health. They can find us on YouTube, Axon Health, all one word. they can find us on Facebook.
Our Instagram's one word. So it's Axon Health, just one word. Mm-hmm. And like I said, we spend a lot of time educating patients on stuff like that. Our schedule ranges from habits to exercise and nutrition evidence to facts about our business on Fridays to mental health videos that we think, business videos. So we really have a wide variety of things that we do, and we really like that.
We're really big on education, but otherwise, I don't know if you want our phone number, but it's 719-358-9460 if that makes it easier for anybody.
Perfect.
Yeah.
Well, everybody knows how to get in touch with you guys. And again, thank you so much for taking the time to share more about your company, about you guys particularly, what your goals are, and how you can help people.
Thank you so much for having us on.
All righty. Have a good one.
Thanks, you too.
Bye.